Harris Helberg is a current Royal. He was working on the front lines as an EMT before contracting the novel coronavirus himself. He is currently under quarantine, and he is kind enough to join us and talk to us about his experiences both on the front lines and having contracted this virus. Harris, I feel terrible for you. I really do. How are you feeling right now?
Right now, I'm pretty okay. I just feel a little under the weather, but thankful that's not anything worse.
Do you know how you contracted the virus? Obviously, working as an EMT in the state of North Carolina, you had put yourself in harm's way. You knew it was a possibility.
Mm-hmm.
I imagine you took all the precautions possible wearing PPE. But
yes.
Do you know how you contracted the virus?
Well, I don't know for certain how I contracted the virus, but I do know within the period of the 9th to the 14th, I was working in Hendersonville as a volunteer, and somewhere within that time, I contracted the virus, but I knew I was working with COVID patients, so the timeline matches up.
Yeah. So how many days ago did you test positive, and where are you now in the sequence of everything?
I tested positive on the 15th, and
so 6 days ago from as we record this.
Correct. And this is also my 6th day of quarantine as well. And so the recommendation is to quarantine for 14 days after the positive test. So that's what I'm doing. And then we'll try to get retested on the 29th, counting down the days and going to see how that works.
Today is Thursday, the 21st, as we record this interview. The incubation period per the CDC is approximately 4 to 5 days to feel symptoms since contracting, since exposure. Right. Do you feel any symptoms?
Yeah, I mean, I do have a head cold. I'm kind of mucusy. I feel a headache. I feel a little achy, but nothing I can't handle. And like I said earlier, really thankful that it's nothing worse for now. I just try to take it day by day and, drink a lot of fluid. I have water and on deck and just trying to do my best to stay healthy.
All reports say this virus is far worse for elderly folks, those with pre-existing medical conditions. You're a young, healthy, collegiate athlete. But is there any worry about potential permanent effects such as lung damage that have been reported as a result of this virus, and any worry about your overall health going forward with this virus?
Yeah, I mean, we have seen multi-system failure for some COVID patients that have some complications or comorbidities. I was actually working at a facility where it was a long-term facility, and a lot of the patients had COVID, and a lot of patients were 65 and older, had other health problems like beforehand. So, and some died, some were really struggling while I was there. And I feel a bit of survivor's guilt. I know you talked about this to the other nurses and folks that came from Queens, but again, I'm thankful that I'm really healthy, and I just take it day by day. Sure, there might be a little inkling in me that is like, oh gosh, I hope this doesn't affect my running career, just my overall health, etc. But I just don't know yet. We just don't know yet.
What sparked you to get a test? Is it just precautionary, a regular thing for EMTs?
Well, yeah, since I was in that facility and there's known cases, and I was in there 8 hours a day, every day for a stretch of 6 days, at the end of my work there, then I was prompted to get a test. So, and it depends on availability of the facility or the local health department. It also depends on protocols in your hospital or in your place of work.
And lastly, about you and the virus, quarantining. Do you worry who you've exposed?
No.
Okay.
I've been very vigilant about staying inside, and that's all I've done. And I'm actually back in Atlanta now, and in my parents' house, and we've taken a lot of measures to not expose them. All the vents are closed. All the circulation down here is nothing circulating. The air conditioning's off. They place a food like outside on a table, and I wait for them to go upstairs, and then I just take the food and I don't bring the plates back. So everything's sealed. No one's coming in here. So we'd like to think that no one's getting exposed.
So you're in your parents' basement. You don't plan to leave for the 2-week period.
Correct. Yeah.
It's just not fun. That's not fun.
I wouldn't say it's my most ideal situation, but adapting and changing, finding ways to keep entertained, calling friends, watching a lot of TV, just trying to pass it day by day.
Yeah. So again, you contracted this as a healthcare worker, and that is the point of this series, to shed light on former student athletes, and in your case, a current student athlete entering your senior season in the track and field program, those who are helping out. And you put yourselves in harm's way. Ultimately, you did end up contracting the coronavirus, but you were a volunteer. Now, if I have this correct or incorrect, let me know. You were working as an EMT in Charlotte and then volunteered to move up to, or were reassigned up to Hendersonville, about 2 hours from here, to help out.
Yes.
Where did you work? What did you do?
So the North Carolina Department of Health said, hey guys, they sent an email out to pretty much all of their licensed healthcare providers and said, hey guys, we're really struggling. We need people to volunteer and help man our facilities. So there's just this big online conglomerate called NC Terms, and you signed up for it, and they would send you emails or places of interest that you could go to help out. So they've sent one of those emails, and I responded and said, hey, I'm willing to help. The school term just ended, so I was done with all my finals and done my obligations there, and I felt a call to action. I felt like I wanted to help. So what they did is they moved me to a hotel room in Henderson, North Carolina for about a week and a half, and they put me in a long-term care facility. And they kind of converted it to where most of the elderly folks that were in nursing homes went to this long-term care facility with COVID. So they're trying to bring everyone together with COVID so it wouldn't spread elsewhere. And like you said, a lot of older folks are more susceptible to this virus. So there I would work with those people, just helping deliver medicine, taking their vital signs, monitoring them, and even depending on their functioning level, we'd have to change them or help them go to the bathroom. So it was a hands-on, all hands on deck type of situation.
What's the worst thing you saw?
I mean, I don't want to sugarcoat it. Really, people died, and it's terribly sad, and you want to kind of take yourself out of it, like, oh, this doesn't matter to me, or oh gosh, but you create such a relationship with these patients. You're with them all day, and I think for me, being an effective healthcare provider is to care, and so it hurt me. It hurt the families that had their loved ones passed away. It's just extremely, extremely unfortunate.
What kind of symptoms? I've spoken previously to Rebecca Cochran, for example, who said she treated a patient with 106, 107 degree fever, and that's just extraordinarily high.
Yeah, we would definitely see low-grade fever, sometimes GI distress. A lot of these people, they weren't at a functioning level that you and I are. Some can't feed themselves, some can't really communicate what they want. So you'd have to really pay attention. That loss of taste and smell is one of those symptoms, but for them, it was they weren't eating. So you'd have to kind of translate that and be like, wow, what's going on here? Is there any other signs of them having the virus? They would also get tested. But okay, this person isn't eating, what's going on? Is this person sick? Do they have COVID? So you really have to kind of put all the puzzle pieces together in terms of COVID diagnosis in older patients that can't really communicate or function as well.
It's almost as if in your mindset, I'm going to go help out. I know I'm putting myself in harm's way. As much as you can possibly protect yourself, you knew at some point you were going to get the virus. Is that yes or no?
I would say no. There's certainly a risk, and I certainly was appropriately anxious or worried about getting the virus, and that anxiousness turned into preparation. I would do all the right things.
Yeah, tell me about the preparation, because the preparation, just to go from treating patient to patient, if you're not diligent, and this is a common theme I've learned during these interviews, if you're not diligent, then your rate to potentially contract this thing soars to almost 100%.
Absolutely. Yeah.
And that's kind of what I meant by the question.
Sure. I think it's also inappropriate to say that people who contracted the virus didn't take the precautions, because there's many physicians and healthcare workers and that have either contracted the virus or died because of the virus, despite all of the right things, despite wearing all the PPE. We had a KN95 mask, which is like the sister to an N95 mask. We then put a surgical mask on top, a face shield. I also had eye protection and gown protection into every room I went to. So I took those precautions.
It's almost as if, can you remember a moment where maybe you slipped up and you touched your face when you shouldn't have, or did you do everything properly and it?
I mean, after my time there, I believe I did everything properly. I would wash my hands after every patient. I would keep my PPE on. I also would only stay in the hotel when after shifts. So I wouldn't even go out after shift. I would wear my scrubs to the hospital, my clean scrubs to the hospital, and pack a clean pair of clothes. And then right before I left, I would put on those clean pair of clothes. So my car, my hotel room, etc., all the other places that I'm, occupying would be close to COVID-free as possible. I would jump in the shower right when I get home, literally just strip down naked and go straight to the shower, touching nothing. So, those types of precautions are just something you need to do. And despite that, here I am.
Yeah. I feel terrible for you. You and I have gotten to know each other pretty well over the last couple of years. You help out a lot with the athletic department. You have a lot of interests outside of track and field and outside of the classroom.
Absolutely.
Obviously working as an EMT. Your photography skills are pretty good.
Thank you. I appreciate that.
So I feel bad for you. I wonder what you were as cautious as you could possibly be.
Absolutely.
And I wonder what you think of and what you would say to folks who have been a little more cavalier with their attitude toward the virus. What would you tell them?
I mean, just wearing a mask is extremely important. I would think about it as less as it's impeding on my liberty, but more as I'm protecting myself and others. So I don't think the act of wearing a mask is trying to restrict anyone's freedom or sense of self. I would say masks are extremely important. I would say 6 feet, social distancing, extremely important. Taking as little risk as possible. Everyone has to go to the grocery store. I understand that. And yes, going every 2 weeks or every week or however you manage that is appropriate, but doing other things that aren't necessarily, I guess, essential or aren't necessarily needed to be done now can wait. And I mean, I was at major risk for being at a place with many COVID patients, and my risk doubled, quadrupled, but the risk is still there in public, and while it might maybe less, it's still there, and it's still something to think about. I think we've exceeded 90,000 deaths as of yesterday.
Yeah.
Or test in the U.S. So it's real, it's there, and I wouldn't underestimate it. I certainly didn't, and I still got the virus. So there you have it.
Yeah. Standard epidemiology practices would tell us that once you've contracted the virus, after you overcome the virus, that you would have immunity to the virus.
Right.
What is your plan next? Will you go back out to trying to help on the front lines versus COVID when your quarantine period is over and when you finally test negative?
Yeah, theoretically, I would get the antibodies to be able to fight off the coronavirus. Your immune system is very, very good. It kind of memorizes these viruses, has a good memory. And yeah, I'm actually I'm in Atlanta now, so, and I think I'll stay here, but there's a hospital system called Piedmont, and I'm going to work as a emergency department technician. So a little different, but still trying to help, you know, the COVID and just trying to help people. And theoretically, I would be more effective. But I would still take the same precautions I would previously as well.
Well, I want to thank you for the work that you've done and the work that I know once you overcome this, we'll get back to doing.
Thank you.
You're really doing the work that is necessary, the hero's work here that folks like myself really couldn't imagine stepping into as we all do our part in trying to stay home. So I thank you. I wish you the best of luck, good health. I hope the family and your parents don't contract the virus and stay healthy. And I hope that there is a track meet in your future to compete in, not too far in the future. Harris Helberg, a former all-region heptathlete, 5 times a member of a conference championship team as well. So
5 out of 5.
5 out of 5, and would have been 6 for 6, and yeah, would have been 6 for 6, but then the spring got cut off, huh? At least you hope.
That's another thing. Losing track was a big blow for me and my teammates and a lot of people. But you just adapt and change and try to help as best you can, and that's an attitude that I've adopted. Just in general and in the events I do. The decathlon is 10 events, and you have to adapt and change very quickly to meet the needs of each event, and you have to get through it, the 2 grueling days. And now that mentality just kind of translates to what I'm doing now. Is just get through every day and face the challenges that you're given.
Harris, be well.
Let
me and us at the athletic department know however we can help. Harris Helberg, thank you for the time.